Do you know, as a pharmacist, you can study a degree in health informatics and work as an informatics pharmacist, right? So, that's another area a lot of pharmacists are not aware about, and that's what I'm going to be talking about in this video. So, you might just want to stick around to the end of the video to find out what it takes and all the steps required, right? Welcome, everybody, back to the channel. If you're new here, my name is Dr. Ron, and I talk about everything healthcare, including alternative careers that healthcare professionals can consider, especially those who are looking to leave in clinical practice and move on to other things. So, like I said, I'm going to be talking about pharmacy informatics or informatics pharmacist, whichever way you want to call it, right? So basically, it's one of the options a pharmacist who wants to leave core clinical practice. You're looking to get involved in tech a bit and apply it to what you're doing as a pharmacist. So this is also a very good option. So by way of introduction, by the way, I have a separate video I'm working on to talk about health informatics in full, though I talked about it on my podcast. So I'm going to do a video about that. So, but health informatics just basically refers to the collection, storage, access, and use of personal health information to improve treatment plans for patients. And if you're a pharmacist who has informatics background or informatics training, basically you specialize in health informatics of medication related patient care. So you primarily focus on the use of technology and communication to enhance factors associated with medication administration and the patient outcomes resulting from it. So things like adverse drug reactions, those are some of the things you might be monitoring as an informatics pharmacist. So again, you're also going to be looking at things around information sharing between clinicians and pharmacists, because that also helps to prevent errors in prescribing or telling physicians, you can't do this, or you need to do this, or you need to change this. And also, generally enhance the service delivery in the pharmaceutical space. Now, for informatics pharmacists, there are a couple of specializations that are available for those who want to specialize. The first one is you can opt to become a drug safety specialist, who their primary function is to monitor drug safety by tracking administration, the use of medications, and generating reports about different medications and what's been done so far. And they also go a step further by auditing medication inventories. So, for example, if you're working in a system or hospital that has electronic health records, so it's easy to do all this kind of audits to see what's going on in terms of medication. Now, another specialization available is the clinical data analyst. So you analyze pharmacy data to ensure effective use of information, and with the data and your analysis, you're also able to, develop and modify systems to access and process pharmacy data. Then another option is becoming an pharmacy informatics technician. So the technicians are usually responsible for imputing data, dispensing medications, and generally, ensuring the systems used in healthcare as it pertains to medication delivery and all of that work very well. So these are some of the few specializations that are available as informatics pharmacists. This list is not exhaustive. If you go online, you're going to see more. Then a lot of persons begin to wonder, what are you going to be doing? What's your day-to-day activity going to look like in the hospital if you work as a pharmacy informaticist, right? So first of all, you collaborate with other healthcare and information technology professionals to promote efficient and safe optimal use of medications in the workplace. You also get to contribute to transformation of healthcare IT by analyzing, designing, implementing, and evaluating information systems. So, for example, if a hospital is looking to, acquire an EMR or EPR or EHR, so there is usually a pharmacy module in that unit. So it depends on the type anyway. There's usually a nursing module, there's an outpatient module, theater module, A&E module. So they're usually a pharmacy module. So the pharmacy informaticist is usually someone who has a very good knowledge about how the systems work, and his input is going to be required and considered top level in designing and deploying such systems. So you can also do that. Then you get to improve pharmacy related metrics through implementation improvement, quality improvement. You perform present data analysis. I mentioned earlier, one of the things you could do is pulling up data from electronic records. So when you do that, you're able to represent the data and present it to stakeholders and for decision making, really. So that's what the job description or day-to-day activity of someone who is a pharmacy informaticist looks like. So I already mentioned you could be a pharmacy analyst, you can be a pharmacy informatics specialist. Now, what are the qualifications required for you to do this? So, first of all, you need to be a pharmacist. So, you need to have gone to school, your first degree, either you have the PharmD qualification or the equivalent for your first degree. So you have to be a qualified and practicing pharmacist. Then, secondly, most employers usually tend to pick people who also have an extra degree in health informatics, right? So, I mean, having a degree in health informatics is an added advantage. So, I mean, it looks like that's the only option really for you if you want to be in this area, to just go do a degree in health informatics. So those are the two key requirements really: be a qualified pharmacist and you have a degree in health informatics. Now, there are a lot of schools out there offering health informatics at the postgrad level in the UK, in the US, Canada, New Zealand. I think, in fact, globally, there are a lot of schools. So it's just for you to do your search and look at where you're going to, your budget or your costs, and all of that, and go acquire the degree and all of that. So some of the schools, I mean, they are so numerous. So if you're looking at moving to Canada to do that course, you'll be looking at schools like University of Toronto, there's UBC, that's University of British Columbia, there's Montreal, there is University of Manitoba. If you're heading to Australia, there is Monash University, University of Sydney. If you're looking at the UK, there's a Swansea University, there's a University of Bristol. If you're heading to the US, there's University of Minnesota, Southern California. So I mean, the schools are endless depending on where your interests lie, right? So that's for the schools. So I get this question a lot. So after all of this, I mean, how much am I expected to earn, or how lucrative is being a pharmacist, informaticist look like? So, well, I tried searching. So, I mean, the salary expectations are not bad. So in the US, you'll be looking at, if you're working in the United States, so you'll be looking at a salary range of at least like 43. I think that was the minimum I found, $43,000 per annum, which can gradually increase as your years of experience and all of that increases. In the UK, you'll be looking at £39,000 minimum and going upwards. In Canada, you'll be looking at about 72,300 Canadian dollars per annum. You know, then in Australia, you'll be looking at 60,000 Australian dollars per annum. Then in Germany, you'll be looking at typically between 2,000 to 3,000 to 4,000 euros per month. So this is what the salary expectation looks like on the global stage. So sadly, in Nigeria, I mean, I don't think that specialization is available yet. So there is no information as to who is working as a pharmacy informaticist. So basically, you still have just the pharmacist, of which I mean, their entry, those are the entry level, middle level, and senior pharmacists. So I think for in Nigeria, you're looking at maybe like 150K for entry level. I think the interns are a bit lower. I'm not quite sure about that salary scale in Nigeria. So that's what the salary expectation looks like. So if you're looking for how to move into health tech as a pharmacist, then this is a good option for you to consider. So do your research, Google all the schools, check which one appeals to you, and go in there, do your program, and the jobs are there. Health informatics on its own is a growing area in the healthcare space. So it's not possible to be out of a job or probably be looking for a job, because there are a lot of opportunities out there with a health informatics degree. Then being a pharmacist, that's a super combo. So yes, that's it for how to get into, or how to become a pharmacist informaticist, or pharmacy informaticist, or informatics pharmacist. So yeah, guys. So so if you're a pharmacist out there looking for what to do, this is a very good option for you to consider. So probably one of these days I'll get somebody who's a informatics pharmacist to come on the show to talk about his or her experience, what he or she did, how they're enjoying it. I can't talk about work-life balance or how interesting it is, because I'm not in that field, right? Even though I study health informatics, I'm not a pharmacist, I'm a medical doctor. So I'll bring those who are pharmacists and working as informatics pharmacists to come and share their story. I think that will be a better way to, for them to share their lived experience, to help people looking for these courses or job roles understand what they are getting into and make better decisions. So if you've enjoyed this episode, please give us a like, subscribe to the channel, and turn on the bell notification so that whenever I have new content or schedule my live sessions, you'll be among the first persons to know. And also, you can still share this video with your friends, your colleagues, because I know a lot of persons are looking for this information, which is really, really very relevant. So I'll be coming your way next week as usual with brand new content. So stay safe, stay cool, and stay blessed. Bye.